Coming at you, RX Healthy Habits, and I'm always worried about people's health being guarded, especially during times of disaster, because I think a lot of times they don't really think about how valuable it is to have a plan when disaster strikes relative to your emergency medication kits. And having some things ready in your house if you stay and you bug in or if you bug out is critical. I'm going to go through and talk about short disaster scenario preparation with emergency preparation kits and also longer, prolonged disaster scenarios that really can be challenging. So, first, short term disaster scenarios, you really want to have a good pain management and first aid kit. What do I mean by that? You need to have some good pain relievers to treat minor aches and pains, fevers, all that. And that's usually acetaminophen, ibuprofen, or naproxen. I like ibuprofen as a workhorse. You need to have some hydrogen peroxide and topical antibiotic ointment for any cuts that may occur. Antiseptic wipes and alcohol wipes are very important to have. Gloves, gauze, and bandages. As usual, most people, when you look in their medicine cabinet, don't have bandages that are going to sufficient for something that could occur. It's amazing. In a lot of these disaster scenarios, people end up getting cut, hurt, doing things to remove trees, or let's say they're trying to do things with cooking and they don't usually use fire. So things happen, right? Allergy and respiratory support. If you're somebody that needs inhalers, you should stock up and have a few. If you're somebody that has severe allergic reaction, is your EpiPen there ready to go? Take it with you if you're leaving. And antihistamines are very important to have for allergies and all kinds of things that may take place, especially in unfamiliar environments if you do leave. And maybe exposure to some substances that might kick up your allergies. The third thing is gastrointestinal health. This is important. Have antidiarrheal medications available. I would also have antacids and H2 blockers, like PPIs like Prilosec, Nexium, Pepcid, some of those available, because usually heartburn and indigestion can kick up because you're eating different foods, let's say, and stress and dietary changes are really going to wreak havoc. So I would have some of those. Oral hydration salts are good to have because if you have diarrhea and vomiting, sometimes excess sweating because the air conditioner is not running, very important. Prolonged disaster scenarios are a different animal. Now, this is where you really need to think about potentially longer scenarios that you're going to need for some things. And I think one of the first things, you need to think about investing in some of these emergency medication kits. Now, broad spectrum antibiotics are usually in these kits, and they'll include things like augmentin, which are really going to be good for respiratory, skin, and urinary tract infections. Ciprofloxacin, those are good for urinary tract, but also respiratory. Doxycycline, that's good against respiratory and certain vector-borne diseases like Lyme disease, if you have tick bites. And then azithromycin, which is a workhorse, usually 3 to 5 day course treatment, which is fantastic. Antiparasitic medications. Really, sometimes when sanitation is compromised, this is important. And these kits that you buy usually do have those in there. So that's kind of interesting. Antifungal medications, especially for females that are troubled with vaginal yeast infections. These usually come with some of those. And you can actually do you can do a pick of some of the ones that you want, but they're usually pretty well designed. There's so many different variations of it. Chronic disease management. Blood pressure medications, I always tell my patients, get a little bit ahead on some of those. I would say minimum 2 weeks, but get a little bit ahead on them. Have an extra supply. Diabetes supplies, I would say more. I would say really try to get your refills ahead and stockpile a little bit of that, especially your insulin. Thyroid medication, same thing. Stay ahead on those. And heart medications, without a doubt, you need to stock ahead a little bit. Get early refills, early refills, early refills. And you want to watch the dates, I get that. Radiation protection, environmental hazards, this is big. If there is a radiation situation with nuclear materials, potassium iodide tablets will really protect the destruction of your thyroid gland. Very important, and they're very inexpensive. You can order those online, and we're going to have links below for you to do that. Activated charcoal is good if you certain type of poisonings that might take place because you got into the wrong foods. N95 respiratory mask, if there is some situations where there's something in the air, really can help a lot. So I'm going to list in the description some notes of some top companies marketing medications. These are top companies that market these medications and these emergency kits. Now, this is going to be also in my blog, which you should come to on rxhealthyhabits.com. They're all going to be listed in there. And here's a neat thing. If you go into some of these, you're going to have a promo code, or it's going to direct you to a place where you might get some really good deals. And if not, just be assured that these are some of the best ones out there if they're not offering that. But a lot of them do, especially for first-time buyers. So I'm going to list those. And also in the blog, I'm going to have a lot of good references. So I can't say enough about it. I think it's something you need to really take a close look at. And I think it might mean the difference between life and death in some of these scenarios. Okay, so with that, I want you to stay safe when SHTF, when stuff hits the fan. Be prepared. God bless.